So how would you treat these different versions of bruxism? For the grinding patient that has no symptoms and their teeth are worn, you can wear just night guard. Whatever you want to call a night guard that covers their teeth. If they don't become symptomatic, that's fine with me. If they have excursive clenching, and that's the TMJ patient, joint strain, dislocated disc, you have a occlusal splint or occlusal therapy that's pretty precise. The absence of posterior contact and excursive movements. Canine rise with quick transition over to incisal guidance without going to canine contact. You can do that in the splint, you can do that with the teeth. But that is really an attention to detail thing there. I wouldn't just take a night guard and throw it in there. Sometimes it helps. For the primary clenching patient, that's the NTI therapeutic protocol is perfect for them. Now, if you take a night guard and put it into a TMJ joint pain patient, sometimes it helps them. Sometimes it doesn't if you don't know what you're doing, but if it doesn't help them, you're like, oh, whatever. But you would not take a traditional, regular old night guard and put it into a primary clenching migraine patient. You'll probably just make them worse and they'll just give you a bad name. You don't want to do that. But fortunately, no one seems to know what's going on anyway. No one's making a full coverage splint for a primary clenching headache patient because we didn't know they were existing. Now, would you make an NTI for the TMJ patient? You bet. Great way to reduce strain and load on a deranged disc. What do you want on a deranged disc? Minimal joint strain and minimal load. How do you get it? You get strain and load. First, you have to have increased muscle contraction intensity. Then you have to have the force vector to pull sideways. So you don't let there be posterior contact and you don't let excessive rotation. Great thing to do. Would you make an NTI on the guided grind? No, don't do that because I have to hear about it, not you guys. So this patient doesn't have any symptoms. Oh man, you're trying to convince him to wear a splint to protect your porcelain, and he won't do it. How about, my wife's got one of those little things. Why can't I just have one of those? Oh yeah, your wife had those headaches and she loves her NTI. Now this guy wants me to make him an NTI. He doesn't have symptoms. He's worn his teeth flat and they're edge to edge. I'm gonna make him an NTI. He's gonna get muscle normalization. His condyle is gonna seat more superiorly, pivoting off the posterior molars, separating his incisors and CO. He's gonna get a little bit of anterior open bite. He's gonna beat the crap out of me. Don't do it. You don't need to. If someone doesn't have any symptoms, you don't need to be making them an NTI device. If they're raging, grinding their teeth, and you talk to them and you know that they've got considerable overlap great. But this is a therapeutic protocol that is quite powerful in helping people when you know what you're doing. You could also mess with someone if you're not really aware of what's going to happen to you. So the when and why of an NTI, here's when. Here's when not to, when you don't need to. That's my show, ladies and gentlemen. If you email me, I will email you right back. Most of the stuff from this slide presentation is at Chairside Splint.